All right, guys, listen up. Atrial fibrillation, also known as AFib, is actually an irregular heart rhythm that affects more than 2.5 million people here in the U.S. and is the leading cause of stroke and hospitalizations nationwide. In tonight's Real Men Wear Gowns, Eyewitness News reporter Jeremy Baker shows us how the university health system is attacking the problem and saving lives.
Electrophysiology is a field of medicine that deals with abnormal heart rhythms. It's also one field where doctors say they can offer a complete cure.
When patients come to us with palpitations, fast heart rates or abnormal heart rhythms, we diagnose what kind of an abnormal heart rhythm it is.
Dr. Jayashree Polarisetti, a university health system cardiac electrophysiologist and assistant professor at UT Health San Antonio, says those problems can be fatal but also fixable.
Patients may be born with an abnormal circuitry in the heart. We are able to identify where it is and ablate it, and these patients no longer have palpitations.
Some of the risk factors for atrial fibrillation include sleep apnea, high blood pressure, and diabetes. With cardiac ablation, catheters are put into the heart and physicians ablate or burn around the pulmonary veins, which are typically the trigger for atrial fibrillation. We
go into the left upper chamber of the heart and we burn around the pulmonary veins and kill the tissue surrounding it so that the triggers that may be coming from these pulmonary veins do not get to the rest of the heart.
Once the procedure is completed, doctors say patients are amazed at how they feel.
It brings about a dramatic change in their quality of life.
Jeremy Baker, KENS 5 Eyewitness News.
And as always, for more men's health information, you can call 210-358-3045. It's the number there on your screen. You can find the rest of our Real Men Wear Gown stories at wearthegown.com.